Thank you, Megan, for hosting us. Andrea, do you want to kick us off?
Yeah, of course. Well, my name's Andrea. I'm a women's healthcare nurse practitioner. I've been working in women's health over a decade, almost close to 15 years now. So I was really excited for this opportunity to help co host this event and talk about the vaginal microbiome and all of its amazing features that it does. And then I'll pass it over to you, Valentina.
Hi, everyone. I'm Valentina. I'm the founder of Daye. I started the company in 2017 after about a decade of horrendous gynecological health experiences, which I thought were just the result of really bad luck. But then through conversations with my peers and my friends, I realized that no, this is actually the norm. Vaginal health is really poorly delivered. And I wanted to create something in the women's health space because I really deeply believe that it is the single most important challenge that we have to resolve for within our lifetime. I really don't want to, if I ever have children in the future, I really don't want to look them in the eye and say, oh, actually, I pass this challenge on to you. And before we can look to, space exploration and flying cars and everything else that we tend to get very quickly excited about, I really think we need to resolve our core issues here on Earth in order to enable over half of the population to fully participate in life and not be stuck at home with a hot water bottle or with a recurrent vaginal infection. Yeah.
Yes, super grateful for this partnership with Wisp. We also have the Day Diagnostic Tampon available on our website as well. So if you have recurrent vaginal infections or just kind of want to get your baseline, it is super unique, cool offering available here in the US to where you can check out your vaginal microbiome. So you can check out Day or Wisp for that.
And if you're not familiar with the vaginal microbiome, it is like the immune system of your reproductive tract. If there's one thing that I really wish was happening in the women's health space, is I really wish we were talking a bit more about the importance of the vaginal microbiome, how to look after it, how to enhance it, how to make sure that we're not actively harming it. Unlike the gut microbiome, the vaginal microbiome is a lot simpler. It comprises of mostly clinically significant bacteria for which there's an established treatment pathway. And in the space of vaginal infections, if any of you have struggled with recurrent UTIs or recurrent bacterial vaginosis, recurrent yeast infections, it might not actually be bacterial vaginosis. It might not be a yeast infection. There might be another pathogen that's responsible for this. So, in order to get customized, tailored treatments, which you can do through the Wisp platform, it's super important to know exactly what's causing your symptoms.
Yes, there's a lot of research coming out about different pathogenic infections, notably mycoplasma and ureaplasma,
Mm.
which the day diagnostic tampon tests for, and those symptoms very much mimic BV. So if you continue to Valentina's point, get recurrent infections, it is really a good opportunity to do some additional testing to make sure that you're treating for the right thing because the treatment for mycoplasma or ureaplasma is different than it is for bacterial vaginosis.
Is it
Yeah.
so BV you treat with antibiotics, correct? So is it just a different antibiotic that treats mycoplasma and ureaplasma?
It is, yes. So typical treatments for bacterial vaginosis are usually with clindamycin or metronidazole. There's intravaginal options and also oral options too. With ureaplasma, there's actually two different species, but the treatment is the same. And then mycoplasma, there's a couple of different species, but the one in particular that can mimic BV is Mycoplasma hominis. These are naturally occurring uterogenital pathogens that you can find in the genital flora. And when they overgrow, they can cause those symptoms that mimic BV. And typically, the treatment for that is with oral doxycycline.
I had a very interesting case in the UK recently, Andrea, where we had a patient who was 28 years old and she had what she thought was recurrent BV and recurrent yeast infection since the age of 18. And she went to a number of different specialists. She went to her general practitioner. She went to different OBGYNs. She went to different vaginal health specialists, and she kept just only being recommended BV treatments or yeast infection treatments. And then most recently, when, the last drop for her was when one of the most recent providers that she saw recommended that she go on antidepressants because that provider determined that her symptoms of vulval swelling, itching, burning, inability to engage in sexual intercourse, inability to even wear leggings because leggings were too irritating. They were all in her mind. They were all made up. So she was prescribed antidepressants for what was suspected to be bacterial vaginosis and yeast infections, but actually turned out to be a ureaplasma infection. So she got tested with the Daye diagnostic tampon and was finally able to obtain the right treatment. But it frustrates me to no end that you have to wait 10 years and potentially go on antidepressants before you can find the right treatment for your vaginal symptoms.
And unfortunately, that's not very uncommon to hear where, women are gaslit or their symptoms are dismissed, or to your point, it's all in their head. I know we see this a lot, even in the perimenopausal and menopausal population too, for patients that are struggling through their transition. And it is really frustrating. We do have a long way to go with women's research. And I think these stepping stones and offer these treatments and guidelines and even these novel diagnostic treatment options are really paving the pathway for us to get to where we need to be. And it's also an opportunity as a woman to be empowered to let your provider know, because some practicing providers that have been doing it for a long time may not even be familiar with these ureaplasma mycoplasma infections. And so if you can come armed with this data to present to them, they may not know the best way to test for it, but you can give them that guidance. That way you can find the answers that you need to be able to take control of your vaginal health.
Yeah, and the data is from CLIA and CAP accredited laboratories, so your provider will know exactly what they're looking at.
Exactly. Yeah. And Megan, I'm glad that you actually mentioned that, because there was actually a New England Journal of Medicine article that came out, I believe it was last month. And what they're showing is that, yes, we know that sexual intercourse and condomless intercourse with a male partner can cause recurrent BV infections with exposure to their external chemistry. They can actually carry the bacteria that can cause bacterial vaginosis in female patients. So what they actually found out in this study is that if the male, so it was conducted in Australia, but with these males, if they actually get topical clindamycin treatment in addition to oral metronidazole, which are treatment options standard for treating female vaginitis with BV, they actually are seeing reduction rates in recurrent BV infections in women, which is awesome and novel, because now you can have this almost prophylactic treatment, because men don't carry any symptoms. They're really the carriers and kind of cause that symptoms for the patients. Yes, here is the exact article. And so Wisp does offer this treatment on our platform for your male partners. If you are getting recurrent BV, that could be something you could certainly explore, in addition to getting your treatment for active infections too. And what the results was female treatment alone was less superior than the male and female treatment.
And women have been talking about this for decades, saying, I keep getting recurrent BV after sex with my partner. Should my partner be treated? So it's really, really exciting to see that the study was finally completed, that we actually have the clinical data. And now guidelines have to change, which will take a while. So your provider may not be familiar with the fact that men should be offered bacterial vaginosis treatments now as well. Testing for bacterial vaginosis in male patients is also harder than it is in female patients. And in the UK, the British Association of Sexual Health does not yet recommend bacterial vaginosis treatment for men, but they were advocating for a change in these guidelines.
Yes, to your point, it is considered off-label treatment. It's not standard medical care at this time, but that doesn't mean that you can't get access to these treatments for your male partner to take control of your vaginal health. So again, another thing to definitely empower you with, to take it to your provider. And they're not calling it sexually transmitted yet. They are doing more research, because there are other ways that you can get recurrent BV too, right? Changes during your menstrual cycle. A lot of people can get recurrent yeast or BV during their menstrual cycle. If you are in wet clothing or damp clothing for too long, those are the majority of the times that you can see that. There are some preventative things that you can do as well. Vaginal boric acid is a really great tool you can keep in your arsenal. What I typically tell my patients, if they do get it either after intercourse with their partner, now you have this treatment available that you can get, but you can also use vaginal boric acid a few days after intercourse, or a few days before your menstrual cycle. What vaginal boric acid does is it has a pH similar to the vagina, and it has antifungal and antibacterial properties to help retain your pH and the good and healthy bacteria in the vagina to help keep that vaginal microbiome in balance to prevent overgrowth of the yeast or the anaerobic bacteria that causes BV.
I didn't realize that boric acid is not readily available in the UK yet. Valentina, can you explain a little bit more about that?
Yeah, so in the UK, the way in which healthcare decisions are made predominantly by the National Health Service, which is the public payer for healthcare, they're made with a balance of costs as well as patient benefit. So just because something has a benefit for the patient doesn't mean that it will immediately be implemented into clinical practice. There needs to be a really strong public health economics case for a new health intervention to be implemented. So there's many benefits to having publicly provided healthcare, but there are also downsides. We don't speak about them frequently. Very recently, I was speaking with one of the largest women's health hospitals in the UK, and they told me that they don't have a budget to screen pregnant patients for chlamydia because the cost is £5 per patient, which is about $8, I believe, per patient, and that was deemed to be over budget. So the US, with all of the issues that US healthcare has, and we can, be on this call all night long to talk about them. But in the US, new clinical guidelines are implemented at a faster rate.
That's really interesting. Yeah, because to your point, there is so much significant screening that happens in pregnancy, and then they even do retesting. I know syphilis now is being tested twice throughout pregnancy because of the surging syphilis rates that we do in the US right now. So
Group B strep, for example, is tested in the US. Group B strep is not routinely tested in the UK. So if you are pregnant, you have to go privately for Group B strep testing. And it's quite important to do so because if you are a carrier of Group B strep, there are implications for your newborn.
Yep. Usually get that penicillin infusion to help prevent sepsis in the baby. So it's really interesting, like comparing the different health systems between, especially when we have access to all the same information, but of course, maybe not all the same resources.
Yeah. So hopefully for the US people on the call, I know there's a lot of bad things that are said about US healthcare, but there are beacons of light in US healthcare as well.
Definitely. Well, I know we had some questions that were dropped before. Do you kind of want to get into some of those questions?
Yeah, let's do that.
I just dropped one in the chat. It's the first one, but I personally would love to know the answer to this, but it says, why does your vulva feel uncomfortable before your period?
Yeah, I don't mind. Valentina, do you care if I take this one?
Absolutely, please go ahead.
Okay, awesome. Well, there are a couple of factors at play here. So right before your period, your progesterone is actually dropping and your estrogen is at its lowest too. And your estrogen is what's responsible for vaginal lubrication. So to that regard, basically you are at the driest during that time. So that can also make you feel really uncomfortable and dry. You also, if you're around your period and it's still uncomfortable, you usually are using moisture wicking materials for menstrual hygiene products, which can further dry out even your vulva. And I know for some people that have lighter flows overall, it can also make it really uncomfortable if you're using those products too. And then the other kind of big call out here too is during your period, you have increased prostaglandins. And what prostaglandins actually do is they help to stimulate uterine contractions so you can shed that endometrium because you're not pregnant. So you need to shed that out and get that all out of your uterine lining. But with having increased prostaglandins, it also increases or decreases your pain threshold as well. So that can also make it more painful. So you kind of got a few things coming from different directions about hormonally mediated, prostaglandins, hormonal as well. And then also just hygiene around that time that can add to that. Anything else you can think of as well, Valentina?
Vaginal infections could be one of the causes. So because of the hormonal changes, you are exposed to a higher risk of yeast infections and bacterial vaginosis. And usually any discomfort around your vulva is a clear indicator of potential vaginal infection. So it's a good idea to either keep monitoring for unusual discharge, burning, itching, or to just get tested. And when we talk about treatments for bacterial vaginosis, yeast infections, in general, vaginal infections, it's very important to keep in mind that the treatments are very effective at killing all pathogens within your vaginal microbiota. So they don't discriminate between lactobacilli, the good healthy bacteria in your vaginal environment, and the opportunistic pathogenic microorganisms. So after a course of bacterial vaginosis or a yeast infection treatment, it's very important to increase your uptake of probiotic foods. That could be kefir, kimchi, yogurt, greens. Onions are an excellent prebiotic. Garlic is a really good prebiotic. Raspberries are a very good prebiotic as well, just so that you can counter the effects from the treatment itself and reduce your risk of ending up in a cycle where you're constantly stuck in infection, reinfection, treatment, infection, reinfection, treatment.
Definitely. Yeah, a lot of back and forth. And then just because of those hormonal pH changes, that's like right around the time frame that you can see those vaginal infections to occur. And even the presence of blood itself, right? That pH is a lot different than
Yeah.
your vaginal overall pH is too. So that can impact it as well.
It looks like
Mel-
Melanie has a question in the chat. She's curious about BV and infections in pregnancy. Would it work against her chances?
Happy to kick us off on this one, Andrea, if you're okay with that.
Yeah, definitely. Go ahead.
It's a super interesting, it's an excellent question, and one that I feel really passionately we should be speaking about more. Bacterial vaginosis does meaningfully reduce your chances of successful conception as well as of carrying a pregnancy to term. So bacterial vaginosis during pregnancy does increase your risk of preterm labor, miscarriage, as well as low birth weight. But that should worry you because bacterial vaginosis is not a complicated condition to treat. So as long as you are aware that you have bacterial vaginosis, either by tracking your symptoms or by getting tested, you can easily obtain treatments, and you can take the treatments while you're pregnant or while you're trying to conceive as well. So it's very important if you're thinking about conception to think about the role that your vaginal health plays in the overall conception journey. This is something that we've seen a lot with the vaginal microbiome screening kits at Daye. A lot of our customers are coming to us because of unexplained long-term fertility challenges. They don't have a hormonal disbalance, they don't have a physiological issue, but the vaginal environment that they have either is toxic to semen or makes the implantation harder or increases the risk of miscarriage. And given how affordable and accessible vaginal health tests are, it's such a crucial step to take on your preconception journey or during pregnancy, for the sake of peace of mind and as good of a pregnancy or fertility outcome as possible.
Absolutely. Yeah. And the other consideration too, in addition to optimizing your vaginal microbiome, is there are ways that you can be empowered to kind of help with your overall fertility journey too. There's at-home intracervical insemination kits that you can use too that actually bypass the vagina, and you can collect your partner's semen and actually put it right up close to the cervix to bypass that. So there is some other options, but to Valentina's point, like trying to take control of the vaginal microbiome and getting treatment accessible and affordably is a good way to kind of set that fertility foundation.
Thank you. I'm going to grab another question from, actually, I see Melanie asked about the Daye probiotics. Valentina, maybe you can speak to that.
Yeah. So when you're considering taking probiotics, it's very important to really check the label and look for a few important things. I know we very frequently focus on the amount of bacteria, the volume of bacteria that is in a probiotic treatment, but that doesn't necessarily correspond with how effectively that bacteria is going to integrate itself in your gut microbiome or in your vaginal microbiome. So what's really important when you're choosing your probiotic treatment is to ensure that the bacteria is freeze-dried. So that means that it's kind of gently put to sleep so that it gets reactivated from your body's temperature after digestion. Because a lot of probiotic treatments on the market are just dead bacteria, which will never repopulate your gut microbiome. It will never repopulate your vaginal microbiome. So make sure that you're using a probiotic therapy which is freeze-dried. And the second key thing to try and see if that's available on the packaging. And if it's not available on the packaging, contact the manufacturer to find out. The bacteria needs to have been tested for its ability to survive in the acidity of the gut and in the acidity of the vagina if it is vaginally administered. So those are two very key considerations to keep in mind. More important than the CFU, the volume of bacteria that is in the probiotic treatment itself. And then another really common misconception is that having more lactobacilli strains, so having multiple lactobacilli strains in one supplement is better than having a single lactobacilli strain in a supplement. What tends to happen when you have multiple bacterial strains is that they actually compete with each other. So again, having multiple bacterial strains does not guarantee better results. So just to recap, when you're thinking about the probiotic therapy, make sure that you're using a freeze-dried probiotic. Make sure that it's been tested for its ability to survive in the acidity of the gut, at least the gut, or the vagina and the gut. And finally, don't be fooled by marketing tactics of, we have 10 billion CFU.
That's helpful. Thank you. Paul.
Actually, sorry, I hope you don't mind, Megan, but I just remembered something that might be interesting for the audience to learn. So you might be wondering how orally administered probiotics make their way to the vagina. And there's a very interesting study that came out of Harvard, out of Brigham's Women's Hospital, which showed that women with more pubic hair tend to have a better vaginal microbiome. And that's because the relationship between what we eat, what we digest, and the health of our vaginal microbiome is because good bacteria, lactobacilli, make their way from our anus into the vaginal opening. So if you have a healthy gut microbiome, that also increases your likelihood of having a healthy vaginal microbiome. And I guess it's just an additional consideration when you're thinking about hair removal options for yourself. If you are someone that struggles with recurrent vaginal infections, perhaps trimming your pubic hair might be a better option compared to just removing it altogether.
Very interesting. I'm going to jump around here a little bit because I feel like this question goes along with what we're chatting about. But what are the probiotic recommended for the US, suppository or supplement?
So I will say, in regards to supplements in general, they're not managed by the FDA. So it's really just based on what we find in good clinical practice. But overall, with supplements and probiotics, what you can see is all systems are kind of interconnected, right? To Valentina's point, a good microbiome can also help to support a good, healthy vaginal microbiome too. So there are actually both options available. There are more vaginal probiotic supplements coming out. And actually, it's really interesting because there's a lot more research coming out, particularly about the Lactobacillus crispatus strain and its benefit to vaginal health overall too. There are some vaginal suppositories coming out on the market, but you can also get an oral one as well. So everybody's body is a little bit different in how they tolerate probiotics, but both options are available and can be viable. But when you do take an oral, you don't know exactly how the vaginal microbiome is going to take that up. So that's kind of my 2 cents with that. Valentina, do you have anything to add?
Yeah, I fully agree with everything that you said. It's very important to do your due diligence. And again, a probiotic therapy is just one of the ways in which you can enhance the health of your microbiome. I see that Niha, I hope I'm pronouncing your name right, has also asked us what you could do to maintain your vaginal microbiome health during pregnancy, preconception, but also given the importance of the vaginal microbiome plays in reducing your risk of vaginal infections, of STIs as well. So having a healthy vaginal microbiome is associated with a lower risk of chlamydia, of HIV, of syphilis. So it's very important to maintain a diet that's rich of probiotic foods. Again, kefir, kimchi, yogurt, fermented foods are very good for your gut and your vaginal microbiome. And we can move into some of the things that you shouldn't do, and douching is the number one thing. I really wish that people stopped douching. There is no reason to douche. The vagina is self-cleaning, and the way in which it is self-cleaning is because we produce lactobacilli, which keep our pH level at the right point, which means that the vagina naturally can defend itself against various pathogenic microorganisms. And when you douche, you wipe away all of the acidity of your vaginal canal, which perversely leaves you more exposed to recurrent vaginal infections. And I know a lot of people douche because they're worried about their vaginal scent. Douching actually can make your vaginal scent worse. I'm not saying that you should care too much about your vaginal scent, but if you do, douching is not the way forward. And then I'm always so surprised when I read and think about the fact that in the US, about 30% of tampons are perfumed. So there is absolutely no reason to use a perfumed tampon. That is a sure recipe to disrupt your vaginal microbiome, to increase your risk of toxic shock syndrome. So perfumed tampons and perfume pads are something that you should definitely remove from your routine.
Yeah, other some nutrition options too. We actually find that low fat dairy is another really good thing to help support higher lactobacillus in the vaginal microbiome. Fruits and vegetables also, which I know you highlighted, and then high fiber diets actually are also really
Mm.
helpful too. So that will all help to dominate the vaginal microbiome with those lactobacillus species.
And we have another question on why does the male semen throw off our pH? Can he take something for that? Again, very interesting question. You would think that evolutionarily this shouldn't be the case. But then again, from an evolutionary perspective, we didn't used to have sex as frequently as we do now. So we weren't exposed to semen as frequently as we would be now if we're having unprotected sex. If you think about, the female physiology from decades ago and centuries ago, we would be pregnant for the majority of our fertile years and therefore less likely to engage in sexual activity. Another interesting thing to be aware of, so if you're someone that struggles with recurrent vaginal infections, you should ask your partner to wear a condom unless you're actively trying to conceive, because the semen will affect your vaginal pH levels and it will increase your likelihood of a vaginal infection. But another thing to be aware of is there was a paper published in Nature. Nature is one of the most prestigious scientific journals in 2008, I believe, which highlighted that exposure to semen around the cervical area actually also increases your risk of a high risk HPV strain infection, which is the virus that's associated with cervical cancer. So if you're someone that already has a high risk HPV strain infection and you're monitoring it to see if it develops into cervical cancer, that's a further reason to practice safe sex.
Yeah, and even around getting your pap smear or getting an HPV, having sex even just around that time can be enough to throw off and kind of cause some cellular changes. So where you can see cytology changes specifically on your pap smear too. So that's why typically if you're using any vaginal treatment, vaginal medications, things like that, they usually do recommend waiting to administer any medication for around 48 hours, even up to a week sometimes before you get your cytology screening done for your pap smears.
And if you're not comfortable with male condoms, I really wish that female condoms would make a comeback. I know they're currently very expensive because they're not manufactured at scale, but the female condom gives you a lot more freedom because you don't have to ask someone to put it on. But I believe in the US they cost about $24 for a pack of 10, which is a lot.
You can usually get a prescription if you ask your
Hmm.
provider, and most insurances will cover that as well. So definitely use that to your advantage too.
Interesting. I did not realize that. I can grab a question for us from the story shares we did. So there's a couple questions relating to ovulation. One of them says, why do I feel bad even though I'm ovulating? I think the general consensus is women are supposed to feel good during this time. And then the second one is asking about a higher sex drive after their period compared to ovulation.
Yeah, I don't mind to take this one if that's okay. So, all in all, everybody's body is a little bit different. So typically, yes, the tagline is, "Oh, I should feel great around ovulation because that's when estrogen is the highest, and I have my feel good hormones." But point blank, everybody's body is a little bit different. So some people have underlying factors, or they have additional stressors that can make that time not feel quite so good. I've seen patients before where they actually feel the best whenever their estrogen is the lowest and their progesterone is the highest. So it's just a difference in how people are around that time in general. And not only is it just like your libido, but also your mood can be impacted with that as well. And then, of course, like stress can play a factor in that too. And then I think, was there a second part of that question too, Megan, that I missed there?
Yeah, the second part is about sex drive being higher after their period compared to ovulation.
Okay, which I think I kind of like hit on that too. So, like I said, I had a patient actually a couple weeks ago that I saw, and she feels so much better whenever her progesterone is a little bit higher and estrogen is a little bit lower. So, definitely just individual changes. Some people do better with different hormonal shifts than others, and everybody's where they're at in their life. It can also change throughout your lifespan too, right? Like sometimes you feel good during ovulation. Some people also have significant cramping that they experience during ovulation too, which can also make it uncomfortable. Fun fact, it's called middle schmerz whenever you experience that. And some people can have a little bit of spotting that can happen during that time too. So if you experience cramping and you have a little bit of spotting during that time, it's probably associated with not a great feeling, but just really individualized per each person. Middle
It, if I can just add to that, it's very hard to actually know exactly when you're ovulating, so you might not be able to time it correctly because if you're using one of those at-home pee on a stick ovulation monitoring kits, they're not that reliable. And the menstrual cycle in general, your hormonal cycle, we've all heard the 28-day rule. It only applies to about 20 to 25% of the general population who have that magical 28-day cycle. For the rest of us, for the majority of us, the cycle looks very, very different. So you might not be calculating the ovulation correctly because it's so hard to do so.
Exactly. And it anywhere from 21 to 35 days is considered normal for your cycle.
What's the normal length of actually being on your period, though, like bleeding?
Anywhere from 1 to up to 10 days. Usually, whenever you do see bleeding beyond 10 days, that's not considered really in line with normal. And there can be reasons why, right? Some people can have polyps, they can have fibroids, they can have endometrial changes. They can also have just hormonal dysregulation and disturbances that can cause irregular cycles and prolonged cycles too. So usually you want to see it at least less than 10 days. If you do experience cycles longer than 10 days, you should follow up with your provider.
Yeah, I couldn't imagine bleeding for that long. Sounds miserable. Okay, I've found another question, and Valentina, you were touching on this a little bit earlier, but what foods influence the best and the worst for your vaginal microbiome? I think you were mentioning like raspberries were good,
Mm.
things that are probiotic and prebiotic.
Yeah. In terms of what foods affect your vaginal and gut microbiome the worst, sugar is the short answer, because sugar feeds your opportunistic, your bad pathogens really, really well. And another thing that influences negative outcomes when it comes to your gut and your vaginal microbiome is not consuming enough fiber. So when you're not consuming enough fiber, your bowel movements cannot happen as quickly and as efficiently as they should. You're also increasing your risk of colon cancer, which we've seen there's been quite a big spike in the rates of colon cancer in people that are, younger than 40. That probably has to do, it's not been scientifically confirmed yet exactly what the root cause is, but one of the hypotheses is that our diets have become really, really short on fiber. And you are probably, currently we're at a time when we're absolutely obsessed with protein, even though very, very few of us will ever be protein deficient. So unless you are severely malnourished, it is highly unlikely that you're protein deficient. But the majority of us in the UK and the US were fiber deficient. So if you're not eating enough fruits and vegetables, because, let's be honest, fruits and vegetables are so expensive these days, can be really hard to, just purchase them. Buying a fiber supplement is a really good hack. So, there's husk fiber, for example, which you can purchase. You dissolve it in a bit of water. It doesn't taste great. So take it as a shot. And if you take fiber just before a meal, it also reduces your sugar spike. So if you, dissolve a spoonful of fiber supplements but husk fiber, into a small glass of water and you eat that, you drink it just before a meal, that will reduce your sugar spike. Those are some of the, and then so sugar, just refined sugar, is a big issue, but the sugar alternatives that we take as well in like Diet Coke, those artificial sweeteners, they've also been tested for having a negative impact on both the gut and the vaginal microbiome. So if you do drink a lot of energy drinks or a lot of Diet Coke, do be mindful of the impact that this may have on your gut and your vaginal microbiome.
Feel like fiber is the silent superhero. A lot of people don't pay much mind to it, but it is so good at like helping with satiety, overall digestion, sugar, and then it even activates your natural GLP-1 receptors too.
Mm-hmm.
So it is I always say like go above and beyond. I like to try to hit 35, but usually 25 grams in women is usually what's recommended.
Very interesting. I did not realize that, but I do have some psyllium husk. I just tried it the other day and I hated it. And I was like, why? Why do we have this? But now I will go try to figure out how to use it. I saw a recipe the other day that was making jam with it, so maybe I'll try to do that.
Yeah. Or chia seeds as well. Like if you just dissolve a bit of, but one thing you can do if you like jam, for example, in the morning on your toast, or if you like to add jam to your yogurt, instead of jam, you can just microwave a small cup of raspberries for just a few seconds, and then you add chia seeds into the raspberries, and it creates something very, very similar to a jam. It's almost indistinguishable from a jam, but it's very fiber rich, and it supports your gut microbiome. And I saw Niha is asking us about oats. So we have to be careful with oats because they can spike your blood sugar. If you are a big fan of Oatly, so the milk alternatives, do be mindful of the fact that they will spike your blood sugar. So drink oat milk and have oats in a mindful manner.
All right. Well, we are at time, so want to respect everyone's time, but on the Wisp end, just want to say thank you so much to everyone that joined us today. We are hopeful to do more of these, so truly thank you from all of us for being here.
Yes, thank you so much. It was wonderful to have this opportunity with you, Valentina, and answer some questions and also help empower people to take charge of their vaginal health.
Thank you so much for having me. It was, I could go on forever. I feel a bit sad that we're out of time, but I hope we do this again very soon.
Awesome. Thanks again, y'all.
Speak soon. Bye.
Bye.